Good morning. I'm going to do an ABG. So the first thing I'm going to do is make sure I have an order from the doctor, and I'll check the patient's charts before I go in to make sure they're not any on anticoagulants, anything that can make their artery bleed longer than normal. So the first thing when I do, I knock on the door, introduce myself, and then I'll check the ID band, and I always wash my hands. And I will assess a patient before I begin. I will check their vital signs and everything before I begin. So when I'm ready, I'll wash my hands and I'll always apply the appropriate PPE before I begin. So when we do this, we always have a needle, our needle ready. So we have a needle. I would set it at the appropriate setting for when I'm ready. I have an alcohol prep wipe, Band-Aid, gauze, the biohazard bag, a stopper, and here. So when we do this, we are going to do a modified Allen's test first. So when we have a patient draw an ABG from their arm, we are going to have them set it out at extended, and we'll have either like a rolled up towel underneath or something just to extend their arm and make it easier for us to get the blood draw. And so I'd explain to the patient, this is not like any normal blood draw. This is going from the artery, and so this is going to be a little more pinched than normal, and you'll probably feel a little pain up the arm just because of where we're drawing it from. So when we do the modified Allen's test, we're going to include the radial and ulnar artery, and then we're going to do a fist 3 times like this. And when they open up their palm, we need to make sure their skin flushes back within like 5 seconds. As long as it comes back, it's good to go. There's good blood flow. And if it's negative, then we need to check the other arm and see if that one is good to go. And when they do that, we still hold on to the radial artery, and we let go of the ulnar just to see if we can feel the pulse and be able to see the coloration come back. And we try to do it on the non-dominant arm every time we do a blood draw. So when I am ready, I will take my alcohol prep wipe, and I'm going to take it on the arm, and I'm going to do a circular motion, make sure everything is sanitized off. Then I dispose of the wipe that I used, and since I already have my needle prepared, then I would just remove the cap off of the needle. And when I do this, I make sure the bevel is sitting up. I'd have the bevel up when I'm going in, and I'm going to hold it at a 45-degree angle. And what I'm going to do is I'm going to palpate the radial artery here. And when I'm ready, then I would stick it in like that, and then I would notice that there would be blood coming through there when it is done. And then when I am done, I would take this out, and I would take a gauze and I'd hold on to it, being very careful not to stab myself. And then I would take and put it through the stopper here. I'd have it in the stopper, and I push it down in there when I am done with the needle. And so you would hold this about 5-10 minutes, just depending on what they have. If they're on an anticoagulant, you might have to be more than 10 minutes. And so when you're done with, if everything is stopped bleeding, you would place a Band-Aid on it, and you'd instruct them to leave it on for at least 4 hours, just because you don't want any infections, anything like that, or any causes of bumping into it and causing bleeding on there. So when I am ready, I need to make sure I have removed so I would remove the needle. I would dispose of the needle in a sharps container, and then with this I'd put a stopper on, and then make sure there's no clots in it or anything like that. Make sure there's nothing that can mess up the reading. Then I would set this in my biohazard bag, and I make sure it's closed. And then I would prepare my label. So I'd have the patient's name, their temperature, their room number, the date that I did the test, what kind of test that I'm wanting with this blood sample. And then if they're on oxygen, like if they're on 35% Venturi max, then I would put the FiO2 of 35%. And then I would stick on the sticker right here. And then I'd need to send this immediately. And if I can't get it to the lab immediately, then I need to put it on ice. So that way it doesn't clot or mess up anything with the reading. So when I am all done, I dispose of anything, make sure everything is disposed of, any blood. If I got if blood got on something, I need to make sure that gets cleaned up. And then I would remove my PPE before I leave the room. I'd wash my hands, reassess the patient, and then I would chart on the patient's chart what I did for them, and then that I sent a ABG to the lab to be read, and then I would go back and then I'd check the results and make sure everything looks good in that way.